The month of February literally focuses on matters of the heart. Why not? It's the month we celebrate Valentine's Day. Seriously speaking, it is a month set aside to bring awareness to matters of the heart. Cardiovascular diseases, that is, diseases of the heart and the blood vessels, are the leading cause of death globally. Coronary artery disease topping that list. Do you know adopting to a healthy lifestyle choice can significantly impact the stats? However, the earlier we adopt to these changes, the better the outcome. In talking about heart matters, I will shed light on the coronary artery diseases with emphasis on those lifestyle choices that will help us reduce the numbers associated with the stats. Hi, I'm Dr. Francisca Osage. Thank you for joining me on Francisca on Health Matters. The heart serves the main function of pumping blood to the blood vessels to all parts of the body in order to provide the nutrients and energy required for body functions. In order to meet up with this high energy consuming task, it also requires blood that will provide the oxygen required for its energy production. It derives this blood through the coronary arteries, which are arteries of a main branch of the aorta. Coronary artery diseases mainly develop from the buildup of plaques on the inner walls of the coronary arteries. The plaque formation, triggered by the wall injury, consists mostly of fatty substances and inflammatory cells, and these plaques build over years. As they accumulate on the blood vessels, this will cause a narrowing of the space they encroach upon, and over time this narrowing will cause a compromise in the blood flow and distribution distal or further down the obstruction, and with time the impact of the disrupted blood flow to the sections perfused by the affected blood vessels soon start to manifest. These conditions arising are what make up the coronary artery diseases. They mainly manifest with chest pain on exertion, that is, with activity, and this is because with increased activity there is heavy demand on the heart to pump out more blood for energy that is required to meet up with these activities. However, with a compromise to blood flow due to obstruction, there soon develops inadequate oxygen within the heart muscles, and this is accompanied with pain, and this is referred to as angina. So the term stable angina is also synonymous with early stage coronary artery disease. Without intervention and with the progression of these conditions and with the continuous buildup of plaques, blood perfusion is severely impacted with continuous lack of oxygen to tissues, especially the heart muscles. Pain then develops intermittently even without activity, and this marks the progression to what is called acute coronary syndrome, which ultimately will lead to a myocardial infarction, otherwise called a heart attack. Now, typically, a heart attack is a result of coronary artery disease due to obstruction of blood flow to the heart muscles as a result of plaque build or disrupted blood clots in circulation. However, there are times whereby the arterial can go into spasm, causing narrowing or obstruction, and this can happen during the use of substances such as cocaine. So these are substances that can also trigger a heart attack. So in cases of heart attacks, timely intervention is highly necessary, and this has to be done in specific settings that are equipped with the resources to enable a stent placement or a bypass graft procedure to be done, and these are in the presence of highly specialized medical professionals, the cardiologist, the cardiothoracic surgeon, but this is done in a timely manner. It is very important to pay attention and recognize the signs and symptoms that might be indicative of coronary artery diseases. There are symptoms of chest pain, and this could be triggered by activity or even emotions. There are symptoms of difficulty in breathing, breathlessness or shortness of breath, weakness, fatigue. For a heart attack, this is characterized by chest pain. The pain is usually described as squeezing in nature, or there is the chest tightness, or pressure-like pain on the chest. The pain can radiate, that is, can be felt at the jaw, the neck, left shoulder or arm, the back. Some women might feel the pain on the upper abdomen. There might also be the experience of sweating, nausea and vomiting, lightheadedness. There's extreme fatigue. It is highly important to recognize these signs and symptoms. If you observe someone going through these symptoms, seek help immediately. Call the helpline. This is 911 in the US. If you are aware this person is not allergic to aspirin, give aspirin. If the person becomes unconscious, perform a cardiopulmonary resuscitation, CPR. And if you don't know how, try giving hard chest compressions with the heel of your palm, one over the other, at the center of the chest, with the person lying on a flat surface, face up. Give about 100 chest compressions per minute. Try doing this until the person shows a response or help comes. Now, although lifestyle plays a huge role to the development of coronary artery diseases, it is important to recognize that aging, the process of aging itself, plays a significant role in the development of coronary artery diseases, and that we can't control. Now, what are the other risk factors that contribute to the development of coronary artery diseases? Other significant risks include high blood pressure or hypertension, diabetes, high cholesterol, smoking, physical inactivity, being overweight or obese, stress, unhealthy diet, especially high intake of salts, trans fat, and unsaturated fats, high sugary diets, alcohol. There's also family history. So hopefully this list can enable us to pay attention to areas where we can make a change or adjustment to lifestyle. There is a need to have healthy diets with lots of fruits and vegetables, including nuts, good amount of protein, and healthy carbohydrates. There's a need to exercise. Try to dedicate at least 115 minutes of moderate intensity exercise per week. There's a need to engage in good sleep, at least 7 hours a day, and healthy leisure. Avoid smoking and alcohol. It is said smoking cessation alone tremendously makes a positive impact in the overall outcome of heart conditions. Now be proactive, have a regular check of your blood pressure, and attend to any pre-existing medical condition. If on meds, adhere to the schedule. Always discuss with your provider about any troubling side effects. There's the need to be proactive. Ensure a regular blood pressure check, and if placed on medicines for a pre-existing medical condition, adhere to the schedule. If there are side effects, have that talk with your primary care provider. You can change the stats for good by being proactive. Let's address in a timely fashion the matters of the heart. Let's develop a healthy lifestyle. Again, I hope you found this informative and educative. And if you've had, please subscribe. And I'll see you in the next one.